My research was on tuberculosis, also known as TB. Tuberculosis can be defined as a bacterial infection that primarily affects the lungs, but it can also affect other parts of the body, including the kidneys, the brain, the bones, and the lymph nodes. We have different causative agents, but the main one is the bacteria by the name Mycobacterium tuberculosis, which is a slow-growing bacteria, and it's an anaerobic bacilli. Mycobacterium tuberculosis is a complex bacterium with different species that causes tuberculosis, and they are listed as follows: M. tuberculosis, M. bovi, M. africanum, M. mycorrhizae, M. caprai, M. pinnipedi, M. caneti, and mugi. This bacteria, Mycobacterium tuberculosis, it was discovered in 1882 by Robert Koch through a lab staining technique, and it enabled him to see the Mycobacterium tuberculosis under the microscope. How Mycobacterium tuberculosis pertain to medicine. This bacteria can evade the immune system and proliferate within host cell, making antibiotic treatment more challenging and potentially resulting in therapeutic failure and antimicrobial resistance. Tuberculosis affect different sites, and those sites include pulmonary tuberculosis, and also there's extrapulmonary tuberculosis. For the pulmonary tuberculosis, in most cases it affects the lungs. Usually the patient will have a cough and an abnormal chest x-ray, and this type of TB is very contagious. For the extrapulmonary tuberculosis, this is type of TB that occurs in places other than the lungs. These places are the islets, the lymph nodes, the brain, the kidney, the bones, and the joints. There are two types of tuberculosis. We have the active tuberculosis, and also we have the latent tuberculosis infection, also known as LTBI. We're going to start discussing the latent tuberculosis infection. For the latent tuberculosis, the bacteria is present in the body of the patient, but is not active. It cannot be spread to other people. The patient does not feel sick, but may become sick if the bacteria become active in the body. Usually has a TB skin test or blood test reaction indicating the patient has a TB infection. Chest x-ray will show like it will be normal. The sputum cultures and smears are negative. The patient should consider taking some preventive medication for LTBI, and also it doesn't require isolation. For the active tuberculosis, the TB bacteria is active in the body. It may spread TB bacteria to others. The patient will feel sick and may have symptoms such as cough, fever, and weight loss. The TB skin test and blood test reaction indicates that there's a TB infection. The chest x-ray will be abnormal. The sputum cultures and smears are positive, and also it requires treatment for the TB disease. It also requires the patient to be isolated. TB is transmitted through talking, coughing, sneezing, laughing, and singing. Risk factors. The risk factors include the immunocompromised status. If the patient is, have other immunodeficiencies, diseases, namely contact TB, close contact with someone who has active TB, pre-existing medical condition or special treatment. If a patient immigrates or travel to countries with high prevalence of TB, institutionalization, like patient in the long-term care facilities, those people who live in overcrowded or substandard housing, also the healthcare workers performing high-risk activities, and also another high-risk factor is substance abuse. Signs and symptoms, they include high persistent coughing that lasts more than 3 weeks and usually brings up phlegm, which may be bloody, weight loss, drenching night sweats, high temperatures or fever, tiredness and fatigue, loss of appetite, coughing up blood, new swellings that haven't gone away after a few weeks. Diagnosis. Somebody might know they have TB after a tuberculin skin test. This is where the TB antigen is injected to determine the extent of immune response. We can also do a CT scan. This helps more to confirm pulmonary TB. Also sputum culture. The sputum is cultured for the presence of bacteria with a special stain. We can also do pleural fluid analysis. This is a group of tests used to diagnose the cause of pleural TB, usually after imaging tests. And then also we have interferon gamma release assay, that is IGRA. It's a blood test to confirm or rule out latent or active TB. There are drugs that can be used for the treatment of LTBI. We can use isoniazid and rifampin for 3 months, 12 weekly doses. It's taken weekly for 12, adds up to 12 doses. We have rifampin. It is taken for a duration of 4 months daily, and the total doses is 120. We have isoniazid. It's taken for a duration of 9 months daily, and the total number of doses is 270. For active TB, the standard drug regimen is rifampin, isoniazid, pyrazinamide, and ethambutol. Also, we have a vaccine for TB. It's called BCG. This vaccine is given to infants and children in endemic countries if they have access to medical or public health. One of the victims who got the BCG, it has proven that to decrease TB endemic in these countries. Its effective wins over time. So even if you are vaccinated, you still need to do the skin test and other tests. For prognosis, tuberculosis can be completely cured with the right treatment, and also without the right treatment, up to 2/3 of the people ill with TB will die. It also causes lung damage that can be permanent. And the following are the references I used for the research. Thank you.